Welcome back to our week-by-week pregnancy updates, Mama. You are 34 weeks pregnant, and if you're joining us for the first time, I'm Bridget. I'm a childbirth educator, birth doula, and a mama, and it's my passion and mission to help parents feel empowered through their pregnancy, birth, and postpartum period, and this channel is dedicated to accomplishing that. So make sure you are subscribed and have hit the bell so you're notified each time a new video comes your way. Now let's talk about your little baby this week. Your little one weighs about 5 pounds and is about the size of a cantaloupe. They are able to open and close their eyes, and when they're awake, they likely have their eyes open, taking in their surroundings through blurry eyes. Babies like to play with their hands and their umbilical cord and are practicing their grasping skills right now in your womb. With your baby around 5 pounds, you're probably feeling their weight and that growing size of your baby on your pelvic floor muscles. There is a lot of strain that is put on the pelvic floor during pregnancy, and because most women spend a lot of time sitting or are under a lot of stress in general or have only been told to do their Kegels, their pelvic floor is actually tight and overactive, or at least portions of their pelvic floor are tight while others are weak. One important thing that needs to happen during childbirth is the release and yielding of the pelvic floor muscles to allow baby to move through them. To deepen your awareness of your pelvic floor and manually release tension in the muscles, you can do a pelvic floor release. To do this, you'll use a wool dryer ball if you have one, or I have them linked down below, or just a bunch of socks rolled up together to about the size of a tennis ball. Sit down on a cushioned surface and place the ball under your vagina and perineum. The perineum is the area of skin and muscle between the vaginal opening and the anus in the back. Sit here for 1 minute, breathing down into your pelvic floor, and try to just fully release. Afterward, you can spend another minute doing core breathing, where you relax the abs and the pelvic floor on the inhale and then contract them and pull them together and up into your body on the exhale, something I teach you in this video linked up here, but also something that we do religiously through the Built to Birth Prenatal Fitness program, which is linked down below. And I recommend starting even now in week 34 if you haven't already, that prenatal fitness program. It's really going to help train your body and prepare it for labor and birth. Another tricky thing for you at this point, Mama, is bending down to pick things up. That growing belly is definitely getting a bit in the way of things, but pregnancy is actually one of the best glute workouts of your life. Squatting down to pick things up and then activating the leg muscles and pelvic floor before lifting is so good for you during pregnancy. Avoid just bending at the hips and then using your back to lift. This is going to put a lot of unnecessary strain on your body and potentially increase back pain and make it more uncomfortable to keep picking things up as your pregnancy progresses. Taking time for self-care at this point in your pregnancy is so important, Mama. I know at this point mamas want to stop moving and sit a lot more, but staying active helps decrease pain, build strength and stamina for labor, and help with optimal positioning for baby in the womb. One of my favorite ways to move towards the end of pregnancy is taking nature walks while listening to positive birth stories, and I have the Built to Birth podcast linked down below that has several positive birth stories for you to listen to. Well, Mama, thanks for being with me in this week's update. I can't wait to see you next week in week 35. Bye for now.